Hi, and welcome to today's Ask the Experts. Today we will be talking with Leigha Senter-Jamieson about talking with your family about health history. Welcome, Leigha. I'm just going to give a little bio on you first.
Great, thanks for having me.
So Leigha is a licensed genetic counselor and associate professor at The Ohio State University's James Center Hospital and SOLA Research Institute, where she specializes in cancer genetic risk assessment in women with GYN cancers. She has more than a decade of research experience in hereditary cancers with a primary focus in BRCA gene-related projects and more than 70 peer-reviewed publications. She is a member of the advisory board for FORCE, Facing Our Risk of Cancer Empowered, which is an advocacy group for patients with hereditary cancers and a partner for NOCC. She is a past member of the board of directors of the National Society of Genetic Counselors and is currently the associate director of OSU's Genetic Counseling Graduate Program. You are obviously the perfect person for us to be talking to today about family health history.
So happy to do it.
All month, we've really been focusing on health history in our social media campaign. And so we're culminating all of that with our talk today. So let's just jump right in. Can you tell our audience why it is important to have an understanding of your family's health history?
Yeah, it's so important. And when we think about how we approach screening for cancer and clarifying a person's risk, the family history is such a big component of that, because otherwise a person's getting screening based on what the general risk is. But there's a subset of people who are going to have a much higher risk, either because they have a family history of cancer, maybe they even have a truly hereditary type of cancer predisposition. And if that information is unknown, the recommendations aren't going to match up. And that's where we really have an opportunity to promote early detection, sometimes risk reduction to the point of prevention. And so knowing the family history, if possible, really can shine a light on what's important.
That's great. And as someone with a BRCA mutation, I relate to everything that you are saying. So sometimes it can be difficult to have conversations with your family about the family health history. How is the best way to start a conversation like this?
Yeah, it can be different with every family and even every family member within a family. And sometimes it's just the first time's always the hardest. You got to kind of rip off the Band-Aid and have the discussion. But I think, we know that there are so many things that can impact those kinds of discussions. If your family is estranged, or maybe you're just not talkers and you kind of are private people and don't really share information, getting that information, it's easy for us to say it's so important, go get it, or go share your own information. But that's not to say we take lightly how tricky it can be sometimes. And so when I'm talking to family members about how they might approach either obtaining information or sharing their own information, I always make sure to point out that it's not something that has to happen all at once. You don't have to sort of give a presentation to all of your family members and share personal information in a big group setting. It's a conversation that can happen over time and should happen over time. Your family history changes. We understand more about different things. So, it always sort of makes sense to start with the people who are closest to you, because that might be an easier conversation to start. But usually if the people are close to you, you're going to feel an emotional tie to it too. It might be hard because you're going to be feeling for them and they feeling for you in a more extreme way, probably. But I also say, call on those relatives who are the knowledge keepers in your family, the ones who sort of keep up with what's going on with everybody and, are taking note of what's happening with cousins and aunts and uncles, because you may get a lot of information from just one person, which makes things a lot easier.
Yeah, that's a great point. It's a great point. What kinds of questions should you ask of whomever it is that you're reaching out to?
Mostly you want to know what members of your family maybe had cancer. So when we're talking about cancer specifically, we want to know what kind it was in as specific detail as you can, understanding that sometimes people don't always know exactly where their cancer started, but you also want to know the ages at which people were diagnosed if possible. If anybody else in the family has had genetic testing, which if they were diagnosed in recent years has become more and more common. You know, if we're talking about grandparents who maybe were diagnosed many years ago, the likelihood that they had genetic testing was probably pretty small. But it's also important to keep in mind things other than cancer. So other people in the family who didn't get cancer, were they living to good old ages, or perhaps did they pass away suddenly from some traumatic event at a young age where we wouldn't have really been able to know if they would have developed cancer over time. Any information is better than no information. So we just say, ask the questions. If you can get ages, that's always helpful to us.
That's something I wouldn't have thought of before, is thinking about people who maybe died young of something else, an accident, let's say. They could have potentially been a cancer survivor or not later, but we wouldn't know that. So yeah, that's a really interesting point to make, I think.
Yeah, and we also talk about, you know, for some hereditary predispositions, particularly if it leads to an increase in ovarian cancer, for instance, if a family is predominantly male, it doesn't mean that that family doesn't have an increased risk. It's just that those men in the family, you know, aren't going to develop ovarian cancer. You know, my dad's one of 5 boys. We wouldn't know, you know, if there's ovarian cancer predisposition on his side of the family. So sometimes when you go for your annual visits, they're just asking very specific, who had cancer, which is a good start. But if you want to get a really full assessment of where things are standing, it's important to know about the people who didn't have cancer too.
So this leads a little bit into my next question, which is who should be included in these discussions, meaning both sides of the family, men and women. But if you could answer, you know, so who should we involve?
Yeah, I mean, you're hitting the nail on the head here. It really is both sides of the family that matter. And these things can impact men too, sometimes in a different or indirect way. But, you know, there is a lot of misconception that even in the hereditary cancer area, that these things only matter if they come from your mom's side of the family, for instance. And that couldn't be farther from the truth. You know, half of people who have something like a BRCA mutation get it from their father. And so knowing your father's history and including men in the discussion is so important. You know, men with mutations often have risks that are higher than average for different kinds of cancer. But another motivating factor is that they may have daughters who it's going to impact in the same way that it impacts you as the person with ovarian cancer, or, you know, the other women in the family. So it's really important to not discriminate in the family about who's getting the information and who you think it's important to.
So I think using that example of your family, where you were talking about your dad came from a 5 boys. If, for instance, they had come from, you know, lots of men in their family too, but had, let's say, a lot of prostate cancer in that side, or one of them had male breast cancer, that might be an indication right there that they could, that eventually daughters like you could be at risk for ovarian cancer.
That's exactly right. And you know, so we also have to kind of cast a wide net on the cancers that we're paying attention to. And so if you have a family history where men are diagnosed with prostate cancer, particularly if it's at a younger than average age or was aggressive at diagnosis, or there's a man in the family who developed breast cancer, independently, those red flags would sort of trigger us to think about something like genetic testing, and by default then can impact a woman's risk for something like ovarian cancer or breast cancer. And we're learning so much about how family history of cancer impacts a person's risk, whether they have a genetic mutation or not. Sometimes we know that you may have a mutation, and that's one component that may influence your risk, but you have a family history too, or you don't have a family history, and that may raise or lower your risk on top of that. So it just sort of underscores the importance that, yes, the genetic test result tells us some things, but the family history gives us the clearer picture. And to the extent that we may not even recommend some cancer screenings, even in the context of having a genetic mutation, unless we also see certain features in your family history. So it really is important to try to get that information if you can.
If someone, I think we may have hit on this, but I'm just going to ask again, if someone discovers that their family health history does include ovarian, breast, prostate, other cancers, what steps would you suggest that they take?
So it's really important to make your healthcare providers aware of that information.
Healthcare providers or certain ones?
I say tell everybody, tell your primary care doctor, tell your OBGYN. They may refer you to a genetic counselor. You can find a genetic counselor on your own if you don't have one that you've worked with already. But, the genetic counselor is going to take all of that information and probably even ask you for some more to do a complete family risk assessment and determine if genetic testing is appropriate, if you've had it already, if it was comprehensive enough by today's standards. And if you're unsure about where to find a genetic counselor, there's a directory on the National Society of Genetic Counselors website. I think it's findageneticcounselor.com. So kind of easy to remember. But you might be surprised if you ask your primary care doctor or your OBGYN, they may have a genetic counselor right there in your health system that they can refer you to too.
So this leads right into my next question. Does it matter if you get tested using a home kit or go to see your doctor or a genetic counselor?
It does. That's the short answer. Of course, there's nuance to that, but most of the at-home testing kits are not as comprehensive from a cancer genetics perspective as what you would have ordered by your doctor or a genetic counselor. So it's really important to not sort of be falsely reassured by a genetic test result that you may have received from a home kit, because it may just kind of scratch the surface, if you will, on what we would order clinically. That said, if you have ordered an at-home genetic test, take that to your doctor, take it to your genetic counselor, and they'll help interpret that test for you and talk to you about whether or not additional testing is warranted.
How about what genes do you think someone should be tested for if there's a family history, or do they do a full panel? How do you decide the difference?
Yeah, some of that comes up to patient preference in the sense that, we know, let's just say the person sitting in front of us has ovarian cancer. We know that the BRCA genes are super important, and we know a lot about those genes and how it can impact health screening going forward and can impact family members and potentially even treatment these days. But we also know that there are less common causes of hereditary predisposition to ovarian cancer too. And I think it's becoming more and more common to do a bigger test because the process is the same, coverage is typically the same. And if the goal is to get information that's going to inform and empower people to sort of take charge of their own cancer risk, we want to make sure that we're, making all of that available. And some of them don't impact risk to the same degree as BRCA1 and 2, genes like RAD51C, RAD51D, they cause a lesser increased risk for ovarian cancer, plus or minus maybe an increased risk for breast cancer, but it can still be so important for a person and their family members that it's pretty standard to test for several genes at the same time these days.
I have one more question for you before we open it up to our audience, and that is, what about if someone's adopted and maybe doesn't have a connection to their birth family? What would you do in that instance?
Yeah, we run into this all of the time, and we do with the information that we have available to us. And there's some experts would suggest that everybody should think about doing cancer genetic testing. And if I have a person that I'm speaking with and he or she is really concerned about a potential for hereditary cancer and they just don't have any information, we can do the testing. And it's really just a matter of casting a wide net then, because we can't really target one disease over another, because we don't know if we're going to find anything. And if we do, what that would be. So in that situation, you would typically do a broader genetic test that might tell you about several different kinds of cancer rather than being very targeted.
How do you recommend that someone keep track of all of the family health history?
Write it down, for sure. I think we always assume we're going to remember all of the important details, but as time goes on, our minds get fuzzy. But I also think it's such a legacy. And when you think about the work that goes into getting that information about generations previous, that's such a gift really to the next generation to have it written down. You've done the work for them, and then they can take it from there and sort of add to what you've already provided and just keep it up to date. So I say, write it down, give it to as many family members as possible, so it's not just in one place and in a silo. There are some websites and online software tools that will actually help you draw a family tree, which can be helpful. It works for some people, not for others. But even if it's old-fashioned notebook paper written down somewhere and shared with family members, that's the important part.
Thank you. Another question we have from the audience is, what are some of the most common reservations you see when people start to have these conversations with family?
Yeah, I think sometimes a lot of people, so when we're talking about people sharing their information or asking family members about their own history, people are often worried about how that relative is going to react. And they're worried that they're going to be upset or scared, or maybe even, the person's feeling a little guilty for even bringing it up. And all of that's totally natural. But I think from actual experience, those family members are usually grateful. They may not be happy about learning about their family history or about a family of genetic test results, because nobody wants to know that they have a strong family history of cancer, but they're grateful, which means that they feel like they can do something about it. But yeah, it's usually worry about reactions.
Are there additional resources that you might think of to send people to for having these conversations?
Yes. So when you see a genetic counselor, they may offer to write letters that you can then tailor and send to family members. We are pretty accustomed to doing that. So we're always happy to make that available. But there are also some resources. Force that you mentioned at the beginning of the conversation has some guides for talking to family members that really can help arm you with thinking through the possible scenarios, so you feel a little more confident in doing that. And, some of our projects that we've been working on at Ohio State, we've been making messages that are video based, so that you can just text a relative or send them a website where it can help explain your genetic test results. So there's no right or wrong way to do it, but it's a lot of information sometimes. So having resources to provide is always really good.
I'm just looking to see if we have a few more questions. Hold on. I'm just going to encourage people who are out there, perhaps if you have questions, we have a few more minutes.
Yeah, and while we're waiting for those to come in, one thing I would add is, if you personally have had ovarian cancer, genetic testing should really be part of your care. And if it hasn't been, ask your doctor about it. But also, if you have a mom or a sister who's sadly passed away from ovarian cancer and that wasn't part of her care because maybe it was a long time ago or it just didn't happen, having a close relative with ovarian cancer is also enough to qualify for that genetic testing discussion, because 20% roughly of ovarian cancers fall into that hereditary category. So we want to make sure that we're making that a possibility for anybody who has a close relative.
You just said something and then that quickly it went out of my head. I was going to elaborate on that. Just as you were talking before, though, we were talking about resources, and we did put on NOCC's website a downloadable family health history guide as well.
Great.
Just want to point out. So we've kind of talked a lot about getting your family history, and then maybe since we do have a few minutes, just maybe touching upon, we talked about telling your doctors and what you would do. Maybe you would get tested, maybe you wouldn't, because you are a genetic counselor. What about those people then who maybe have found out that there is a family member who has a genetic mutation, or it looks like there's a strong possibility, and they're afraid to be tested? How would you encourage other family members? Let's say you're the one who's got the mutation and you want to encourage other family members to get tested. How do you have those conversations?
Yeah, everybody sort of arrives at that in their own time, at their own pace. And some just decide that genetic testing is never part of what works for them. And, this is another part of making sure it's not a one and done conversation. I mean, you don't want to badger your relatives to death, but sometimes it just takes time, or it's the time at the person's life where it's just not a good idea. I always think about people who have children who are very young adults, early 20s perhaps, or even 18. Could we do genetic testing for them? Sure, we can. But even with a BRCA mutation, it's not necessarily going to change a person's screening for years. And if they're a male child, it could be many years. And so the timing of those conversations and giving people space to consider it is so important. I think as a genetic counselor, the components that frustrate me sometimes are when a person's afraid to do testing or even have genetic counseling because they're worried about issues that are really myths more than anything else. So, people are worried about losing their health insurance, for instance, through doing genetic testing, which is a completely valid concern, but there are protections in place. And so we just really want to make sure that people are well informed with good facts so that they can make a good decision for themselves, with the understanding that your decision today may be different than it is next year or even tomorrow. So having an ongoing discussion is really important.
So one question that we got was, you have to be referred to a genetic counselor to go see one. And also, what is the cost in getting genetic testing?
So the referral necessity is going to be a little different depending on which genetic counselor you're seeing. For some, you can self-refer, and if you call a genetic counseling office, they'll give you that information. They may say, oh, no, we don't need a referral. We'll just put you on the schedule, versus, call your doctor and have them send over the referral. It kind of can go either way. And the cost of genetic testing has come down tremendously in recent years. And there are programs that make it really affordable, even if you're underinsured or completely uninsured, usually from the testing laboratories. But if you have had a cancer diagnosis or you have a family history of cancer, often, each insurance company kind of has different criteria for what they consider to be medical necessity, I guess, for covering the cost of testing. But often your cancer history, family history will help get it paid for. And certainly a genetic counselor will tell you the least financially costly way to go about it.
One more question, and you touched a little bit upon some of the myths. Can you talk about some of the other myths maybe that are out there about genetic testing, or talking to your family about health history, things that you hear that are misconceptions often?
Yeah, so I mentioned this a little bit earlier, but the idea that only moms can pass ovarian cancer related things on to their children is obviously not true. The fact that having a mutation in one of these genes that increases ovarian cancer doesn't impact men at all, which is also not true, because it may impact their risk for other things like we've discussed, like prostate cancer, male breast cancer. But also, people think that genetic testing is really expensive, that sometimes it means that it's a guarantee. So if you have a certain genetic test result, you absolutely are going to get cancer. And that's usually not the case either. You have a higher than average risk, but that allows us to do something about it. And I also think sometimes people don't really know what we're capable of from a screening or risk reduction standpoint. And so they think, I've already had cancer, or everybody in my family's had cancer, so why bother? I'm definitely going to get it. But we are getting better and better at making it so that people can hopefully get ahead of that risk and not find themselves in the same situation their relatives were in.
And kind of piggybacking on that, if you are the one who is the patient and you receive genetic testing, in some cases that can dictate your treatment as well. So it does open up maybe some other doors for treatment. So another reason for getting genetic testing. I'm going to give one more shout out in case anybody wants to ask another question of Leigha. And if we don't have any, give it 30 seconds or so, then we may close out for today.
Awesome.
See anything come in. So thank you so much for sharing all of this great information. This is very beneficial for anyone whose family has been touched by ovarian, as well as breast or colon. Oh, nope, never mind. I thought there was another question. It was just my phone going.
Oh.
So I thank you very much, and I hope that those who are watching found this very informative today. We look forward to seeing you next month in November. And I believe that there will be an evaluation in the chat of this Facebook. If you can fill that out, that would be super helpful. Thanks, and have a great day.